The honourable member for Elmwood-Transcona.
Thank you very much, Madam Speaker. And I want to start by saying that I'll be splitting my time with the member for Victoria. I'm rising in the House once again today, Madam Speaker, to address the issue of Pharmacare. I think it's unfortunate, frankly, that we're still really only addressing this issue through opposition day motions. And it's a testament to the fact that the government hasn't brought anything to the House that would advance the cause of a national pharmacare program. It's something we know we need. We've made these arguments many times before, but Canadians themselves have a really real and intense sense of the need. When we did a telephone town hall in my riding, we just kind of asked as a straw poll of the several hundred people who were on the call, how many people either themselves or knew somebody, a close friend or family member, who was cutting their pills in half, or who was choosing to go without food, or struggling to pay the rent, or going without their prescription drugs because they had to choose food and rent first and deal with the kind of consequences of not being able to manage their illness. And it was about a third of people in Elmwood-Transcona. That's consistent with national polling that says a lot of Canadians are in this boat. And, well, why are they? If you look at international drug pricing, we know that Canada pays among the highest costs for drugs. In fact, we had the parliamentary secretary to the Minister of Health earlier in this debate said, you know, we need to figure out why it is that Canada's paying, you know, among the highest prices in the OECD. Well, we know why. It's because we're one of the only countries without a national pharmacare plan. Madam Speaker, it's not a puzzle, it's not a mystery. We know exactly why. So the parliamentary secretary to the Minister of Health was kind of talking about how they're working at the problem around the edges and wondering why they're not having any success. We know from report after report after report going back to the 1960s that the way to make serious progress on this issue is to cut right to the heart of the matter and have a proper national, universal, single-payer, public pharmacare plan. And if we were to do that, we would see Canada's standing in that OECD drug price listing go down significantly. It's not a mystery. The only mystery is why a party that promised this 23 years ago in their election platform and has had a number of majority governments since hasn't been able to get it done. It's charitable to call it a mystery. It's a mystery if you don't give what I think is an obvious explanation to those who are not in a charitable mood, which is that drug company lobbyists and insurance lobbyists clearly have a lot of influence in this government, and that's why we're not able to make headway on this important issue. What we hear from the Liberals is that, you know, the NDP just wants to move too fast. They're in such a hurry. But I mean, Madam Speaker, when we're talking about a policy proposal from the 1960s and a Liberal promise from over 23 years ago, I hardly think that we're moving too fast. You know, I mean, that would be like saying to somebody who took out a 25-year mortgage on their home, they're moving too quickly. they shouldn't amortize their home over 25 years. They should take longer. I mean, this is 25, you can do a lot in 25 years. There are people who have died waiting for a national pharmacare plan, and I hope there won't be any more, because the evidence is there, the research is there, and we had hoped that we had the conditions in this Parliament to make it happen. Earlier in the debate today, there was talk about, you know, bringing in Medicare across the country, and how that was a function of collaboration of a Liberal minority government under Pearson at the time and the NDP in the 1960s. And we had hoped that if there was the willingness there on the part of the Liberals to make a bold policy move, that like these circumstances are them, Madam Speaker, and we're willing to work with the government. We've drafted legislation that provides a framework. We've brought a motion here today. The research is already out there. Not only is it out there by the Parliamentary Budget Officer, by a number of civil society groups and academics who have studied the issue, but the government commissioned its own report from the last Parliament that recommended exactly what we're proposing. So the research is done, the conditions in Parliament obtain. If the Liberals need somebody to go blame to the insurance companies and the drug companies, well, we were trying to look out for your profits, but you know, those bloody NDPers just wouldn't give us a break, and we got to do this. They can blame us, that's fine. We don't mind looking bad in the books of insurance companies and pharmaceutical companies if it means getting a win for Canadians who are struggling to pay their drug prices. Blame us.
Hear, hear.
That's how we've got a lot of good stuff done in this country. But the problem is that this government doesn't want to deal and they don't want to move forward. And I think the frustration here sometimes is I think a lot of Canadians felt that if we got a parliament that looked like this one, we could move forward on a common sense policy proposal. That, often when we talk about helping people out, Madam Speaker, a common theme and objection that comes up is, well, what's it going to cost? Where are you going to find the money? The fact of the matter is, on this one, Madam Speaker, we can afford not only to maintain the existing level of service, but to expand it to everyone and to save billions of dollars at the same time. So the money is already being spent. In fact, we're already overspending on prescription drugs in Canada. We have the research. We thought we had the political conditions to be able to get this done. And I feel like part of what's happening, if you look at this and the reluctance of the Liberals to use this Parliament to make significant gains on this, it's a little bit just like an outdated conventional wisdom. This is not your grandpa's Liberal Party. They haven't been the same since 1993, but there's still an image in the heads of a lot of Canadians. They think back to constructive minority Liberal governments that worked with the NDP to get good things done, but it's a little bit like putting butter on a burn. That was something that people used to do because that seemed like a good idea. But when you look at the evidence that we have so far in this Parliament, and from the Liberal majority governments from 1993 onward, I think we can see that actually that's becoming a dated notion. The evidence disproves the claim that Liberals are here to do real progressive work and are willing to sign on to innovative new social policies that not only save money but can also expand service for Canadians. I think that's a message that Canadians should take seriously. There was a lot of talk in the last election about what a minority parliament could produce. And I know that for people in Elma-Transcona, and not just in Elma-Transcona, but right across the country, there was a real hope that we would be able to get this kind of collaboration. So this is a starting point. As I say, Madam Speaker, we've done a lot of work in order to try and make it as easy as possible for this Liberal government to move ahead, to go forward. It's something that we desperately want to see. It's something that I think when you look at the potential benefit for Canadians in their everyday life, it's huge, Madam Speaker. And it's rare that you get that kind of benefit while saving money at the same time. So according to the Parliamentary Budget Officer, we're talking about over $4 billion a year that we're already spending that we don't have to spend. And if you look at some of the other studies, they talk about $6, $8, $10 billion a year that we could be spending. I think the PBO report is kind of universally acknowledged as quite conservative in its assumptions. So here we are. We've got the political conditions. We've got the research. We can get it done. And that's exactly what we need to do. And we're just waiting for that to happen, Madam Speaker.
You have to call for split time again. They didn't hear you.
I know. Thank you. Thank you.
I heard her say split time. I'm sure it got caught.
He indicated that he was splitting his time, so I'm well aware of that. He's got just a little over a minute.
I appreciate my colleague's enthusiasm to hear from the member for Victoria. I'm looking forward to her speech as well. It's going to be an excellent speech, and because it's a really important topic. So I'm just gonna wrap up, Madam Speaker, by reiterating again. I mean, it's rare that you have such a clear-cut public policy opportunity to save money and to expand services for people who really desperately need it, Madam Speaker. We spend so much time in politics listening to politicians who say, we need to cut the budget, we need to save money, we need to balance the budget. The biggest cost driver for provincial health budgets that are paying for prescription drugs already is prescription drugs. So we can do something about that by mobilizing the purchasing power of the country and expanding service for Canadians. So thank you very much for the opportunity to make those remarks today, Madam Speaker.
Questions and comments? The Honourable Parliamentary Secretary of the Government House Leader.
Yes, thank you, Madam Speaker. The member was here when we heard about the bloc talking about the Quebec program, and there is a Pharmacare program in the province of Quebec, and much like how Saskatchewan played a very important role in terms of us having that international or that strong national presence on a national healthcare program, I think that Quebec can play a very important leadership role in terms of a national Pharmacare program. My question to my colleague is, would he not agree that in order to be able to have any form of a national Pharmacare program, that it's absolutely critical that we work with provincial jurisdictions, given the important role that they play in healthcare?
I remember for Elmwood-Transcona.
Yes, thank you, Madam Speaker. In response to the member's question, I'll just read item B from the motion. Call on the government to implement the full recommendations of the final report of the Hoskins Advisory Council on the implementation of national pharmacare, commencing with the immediate initiation of multilateral negotiations with the provinces and territories to establish a new dedicated fiscal transfer to support universal single-payer public pharmacare. It's right in the motion, Madam Speaker. Of course we believe that it's important to work with the provinces. That's why we put it in the motion.
Questions and comments? The member for Calgary-Shepherd.
Thank you, Madam Speaker. I'd like to thank the member for his contributions to the debate. I've been listening to what people have been saying. I want to remark, I was more of a commentary on what he said and what his colleague, when he introduced this motion in the morning. On November 25th, 2019, the Minister of Finance in Alberta sent a letter to the Minister of Finance federally indicating that Alberta will not participate in a national pharmacare program. In fact, it'll be asking for the same deal that Quebec has. So I just want to make sure that's part of the official record here, that it is an official ask of the Alberta government. In this debate, too few members have talked about access. They've talked about prices and how difficult it is to pay for some of the latest medication, precision medicine. But access for patients is what patients want to hear about. And too few members have mentioned, I think the member from Montcalm was the first one to actually make a big deal out of it. Patients with cystic fibrosis, patients with chronic kidney conditions like my children, national pharmacare is a recipe for disaster. When I look at Cadith twice said no to Orkambi. And when we go to this patchwork system in the United States, you can get access to Orkambi. You can get access to Trikafta. You can get access to needed medication. So I just want to be careful when members talk about it's going to get access to everybody. It isn't. This system will not work for rare disease patients.
The honourable member for Elmwood-Transcona.
Yeah, I mean, I think there's been a lot of debate and discussion and research on how medication for rare diseases is a separate category and needs to be treated differently. The idea isn't that that a national pharmacare plan is going to be a panacea for every patient for every condition. But the fact of the matter is I think the member has been pointing out often in the House, not just in the debate today, but otherwise, people already have trouble accessing those drugs in Canada under a patchwork system. That's not a reason not to have a system that makes it a lot easier and a lot cheaper to access common drugs for most Canadians, and then to work on an appropriate solution for people who are struggling to get access to medication for rare diseases. So I think the member sees these two things as being in fundamental opposition. I disagree. I think he's identifying a legitimate need that I think needs a policy response, but the policy response isn't to negate all of the benefits of a national pharmacare plan.
On a temps pour une brève réponse.
We have time for a brief answer. The honourable member for Berthier-Masquinongé. Thank you very much, Madam Speaker. I'd like to congratulate my colleague for his remarks, and I'd like to ask him a question about what's being asked for by the NDP. Why not do like Quebec? It's a provincial jurisdiction. My colleagues asked clearly why, as part of the motion, it didn't say in black and white that Quebec should be able to have a full opt-out. Now, platforms are all very well, but promises have been made over the course of history. I could talk for 45 minutes and I wouldn't be able to go through the list of promises that have been made. So why wouldn't it be included? I'm disappointed that we have to vote against this. We're not against Pharmacare, but we are here to protect Quebecers and the power of the Legislative Assembly. So what is the true intent by not including that? Is it because you want to look more progressive than we are? I'll have to ask the member to answer because we're running out of time. When I say brief question, that's what I expect. The honourable member for Elmwood-Transcona. Thank you very much, Madam Speaker. Our health critic said today that that is our policy and it's part of our platform. Quite frankly, we hope that we'll end up with a plan that will work and that will be so good that Quebecers will want to participate in that program too. If they want to, wonderful. So we don't want to start out with the assumption that they will not participate. We want people to be convinced that it will work, but it is their choice at the end of the day.